April is Rosacea Awareness Month, and tonight we're taking a closer look at the chronic skin condition that often leaves people red in the face, both literally and emotionally. Many sufferers are embarrassed by the facial redness and even avoid going out altogether. Dr. Mitchel Goldman is here to talk about the signs, symptoms, and of course treatments, as he is every Tuesday. Thanks for being here.
Good to be here.
Well, first, when is appearing red in the face more than blushing or being flushed or in some cases being angry?
Well, you know, about 16 million Americans have rosacea, and most of them actually have a Scotch-Irish heritage, but it can occur almost in any race. And the problem is when there's some triggers that occur, you're going to flush a little bit more, and that's going to lead to developing more blood vessels. So what that happens is, you know, when you look at someone with a flushy face with lots of blood vessels, all of a sudden you think, oh, maybe they're an alcoholic, maybe they've got something else going wrong. And so it really leads to low self-esteem. Things like sun exposure, as you said, Kath, can definitely bring this on, as well as alcohol and spicy foods.
So women also tend to get it as well, correct?
Yes, and it can occur especially during the menopausal period where you're going to be flushing anyway, and that can actually make it worse. But most of the time, rosacea really doesn't start until the 20s and 30s and may eventually actually burn out. But once you have rosacea, there's about a 40 to 50% chance you're going to have it the rest of your life. These are the early stages of rosacea that we're seeing, but it can really progress to almost an acne-like condition where not only the redness, but you also have these little acne lesions. The best news, however, is that we can actually treat rosacea. Rosacea, although it's mostly genetic and can be caused by lots of triggers, tends to be occurring in people with a type of a mite called a Demodex. Now, this is a mite that's on everyone, but people with rosacea tend to have more of these mites in their skin. It's actually in the oil glands, and they have a sensitivity to it. So we can use a variety of vascular lasers or intense pulse lights to actually treat that and keep it in remission for many, many months, even up to a year.
Is that the only avenue you can take to sort of minimize the redness, or are there things you can do at home for treatment?
Yeah, there are a number of different topical medications that can be used. Some are more effective than others, and your dermatologist can prescribe those to you. One of the most old-fashioned one, which actually works, is something called sulfasalicitamide, or a type of a soap, and that can make it better. There's another one called metronidazole, which is a gel that can make it better. These patients that we're seeing were actually treated with an intense pulse light or a treatment called photodynamic therapy, and that specifically targets not only the blood vessels, but also those Demodex mite, as well as the abnormal types of bacteria that are on the skin.
And real quickly, before we leave you, then you should consult a dermatologist, not just your general practitioner.
Well, many general practitioners are pretty good with this since it's such a common condition, but your dermatologist is the one that's going to be most expert and will be able to use lasers, intense pulse light, photodynamic therapy to make it get better. The thing that we should leave our viewers with is that if you have rosacea, obviously avoid the triggers, avoid the sun, and if you're in the sun, of course, sunscreen, avoid a lot of hot and spicy foods and alcohol and stress. But if you have it, it is very treatable, and you don't have to just be on antibiotics.
Thank you so much, Dr. G. I'm sure you brought relief already to some people suffering at home. Thank you.
Good to be here, Kat.
Well, still ahead.